Today we're going to be talking about the opioid crisis, specifically needle exchange centers. I'm Alana.
I'm Arlette.
I'm Melissa.
Okay, so an overview. These programs are used to minimize the negative consequences of injection drug use, such as the transmission of HIV and hepatitis C. They're seen as practical tools to reduce disease, promote safer practices, and connect users to better treatment options. A lot of users don't really have treatment options, and so having these programs at least helps them to have clean needles to use. So this approach brings up a lot of moral and ethical concerns. Some people think that giving out clean needles can make people who are users feel more encouraged to use the drug, which could go against efforts to stop addiction and help people become clean. They might feel like needle exchange programs send a mixed message because they are trying to help users, but they're also making it easier for users to continue in these habits. It creates a bigger debate between doing what works from a healthcare standpoint versus sticking to certain values or core beliefs that some people might have.
So, some pros of needle exchange centers would be reduced disease transmission. So, clean needles help the stop of HIV, the spread of HIV, hepatitis B and C, and other infections from sharing needles, and then improves community safety. Needle exchange lowers the number of used needles in the public, protecting others, including nurses and first responders, from accidental needle sticks. And then it encourages treatment and recovery. These programs help build trust and can guide people towards recovery options like assisted treatments. And it reaches underserved populations. Needle exchange support people dealing with mental health issues or unstable housing who may not use regular health care. It helps reduce overdose deaths. Many programs provide Narcan, which reverses opioid overdose and helps save lives during the opioid crisis. And finally, it builds trust with healthcare providers by offering respectful and non-judgmental care. These programs make it easier for people to seek out medical help in the future. And some cons of needle exchange center would be may enable continued drug use. So some believe that giving out clean needles could make it easier for people to keep using drugs instead of feeling the need to ask for help. It delays in treatment. Even when treatment is offered, people might avoid it because of fear of withdrawal or bad past experiences with rehab. It doesn't fix deeper issues. Needle exchange doesn't address mental health problems or trauma that many users are dealing with. Community stigma and pushback. Some neighborhoods don't support these programs, worrying they might increase drug use or bring more drug activity in the area. And then limited long-term support. Without a clear path to treatment, these programs may stop at harm reduction and not help people fully recover. And then finally, moral conflict for providers. Some healthcare workers feel torn between supporting harm reduction and wanting patients to reach full sobriety.
Our group's stance, our statement is we believe supporting needle exchange programs is the right choice, both ethically and logically. These programs follow the core healthcare values of beneficence and non-maleficence by helping reduce the spread of serious disease like HIV and hepatitis C.
Rational, based on critical reasoning and ethical decision making, these programs are based on the principles of beneficence, which means doing good, and non-maleficence means avoiding harm. These help reduce the spread of serious infections like HIV and hepatitis C, which is a major win for public health. Critical research shows that these programs don't promote drug use. Instead, they connect people to healthcare, education, and treatment options. Supporting needle exchange programs is not about enabling addiction, it's about compassion, evidence-based care that benefits both individuals and the community. The Code of Ethics for Nursing, Provision 1, means nurses are obligated to honor the inherent dignity and worth of every individual. Supporting needle exchange programs recognizes the humanity of those living with substance use disorders. Provision 2 is the primary commitment of nurses is to their patients. Needle exchange programs help lower the risk of infections, safeguarding vulnerable patients from avoiding harm. Provision 5 is nurses have the duty to themselves that mirror their responsibility to others, which includes supporting NEPs, exemplifies integrity in promoting compassionate and evidence-based interventions. And the last provision, provision 8, nurses must work together to uphold human rights and address health disparities. NEPs foster equality by assuring that unserved communities have access to clean supplies and essential health resources. The Nursing Practice Act is the key role in educating the community and protecting public health by help prevent the spread of diseases and encouraging safe behaviors. It is also important that we stay with our professional scope and follow ethical standards. By supporting needle exchange programs, we are not just doing what's ethical, we're also meeting our legal and professional responsibilities as nurses.
And then these are our references. Thank you so much for taking the time to listen to our presentation today.
Thank you. Bye.